Real healthy energy, real mental clarity, and real comprehensive health in a take-anywhere package. Say hello to Taka. Bursting with a delicious tropical flavor, Taka is an all-in-one solution that gives your body the support and nutrients it needs. Taka is packed with vitamins, minerals, and superfoods to help you feel refreshed and energized throughout the day. Designed with you in mind. The key ingredients: aloe vera, hibiscus, ionic minerals, turmeric, rhodiola, fucoidan. Taka is your daily solution to investing in yourself and rediscovering health. Try it, love it, talk about it. Visit Globallee TAKA to learn more.
Ladies and gentlemen, first of all, it's an honor to be on the call this evening. I take this very seriously, what I do. I love my Globallee family. Thank you, President Lamia. Thank you, Brother Mark McKnight, your lovely family. Thank you, Lauren. Thank you, Scott, Mr. McKnight. Thank you, Naughter, all of you. Without further ado, I'm going to take you back to 1982. I graduated from Corpus Christi State University at a tender age with my registered nursing degree. I have a bachelor's in science with a master's in public health from the University of Texas, 1987. After working 20 years in a cardiothoracic open heart unit here in San Antonio, I pursued my PhD in pathophysiology from UC Davis and took my board certification in American Critical Care Cardiology for Nursing back in 1988. Don't be impressed with all that, ladies and gentlemen. I have a passion. I love taking care of people. Unfortunately, my mother died of a stroke 6 months before my wedding at the age of 25. And I said the next day after her funeral, I will never let anybody's parents die of a stroke at that age. Cardiology has been my passion for 37 years. So let me fast forward to 2015 when I met Lamia at a previous company. And she came into my office and saw a private label with my name on it. She was fascinated with wellness. I love working with scientists, CEOs, presidents, management who are focused on wellness. And I'm just a small part of Globallee, but the research that I'm about to share with you is so unique that my staff of 7 who work for Let's Take a Look, we decided to have this published next year in Journal of Physiology. So everybody will have a detailed copy of everything. Let's take a look. As a founding CEO, after leaving the hospital, I opened the first cardiac non-invasive mobile scanning company in the state of Texas in 2011. We use a 501k clearance, class 2 medical device that has been approved by FDA in 2010. Let me repeat. All of Let's Take a Look's non-invasive scanners have a class 2 and a class 3 approval by FDA to be utilized as a medical device. And as a clinical pathophysiologist, I'm able to sit with my patients and say a few things that we cannot in MLM. You have to be very careful with the wording and technology. And I was on the call last week, and I was so impressed with the gentleman that spoke about the fact that TAKA, don't even say energy drink. It is more than that. When I share with you the research that was conducted from October 5th to January with 73 Let's Take a Look patients that range from the ages of 19 to 82, you will be quite shocked. The first patient that mesmerized me was lovely Michelle's wife, Mimi, a retired RN. While in Dallas, when I was introduced to Michelle and his wife, a non-invasive cardiac scan was performed on Mimi, and her endothelial stiffness index was over 53. That is shocking. After giving her TAKA in 12 ounces of alkaline water in a mixture, I like my patient to have coconut water because it's high in potassium, we waited 30 minutes. She was rescanned, and her endothelial stiffness, which is an endothelial dysfunction, normally 7 to 8, it dropped her to a 16.3. Michelle, place that in a binder.
It is online. It is online as you speak right now.
That shut my mouth to where when I got back, my 15 boxes of my original order were gone in 3 days. I love working with my team. Two of my team players placed this TAKA in the box of two cardiologist friends, including my friend Dr. Wu, who loves the product, and we began to do some very unique research. And when I say unique research, ladies and gentlemen on this call, a patient on February 14th came into my office referred by cardiologist number 2, Dr. Canales, MD, who was placed on a cardiac transplant list with severe congestive heart failure because he had 3 coronaries that were 100% occluded, 80 RCA, LED, 90% occluded, with a cardiac output of 2.9. After providing this patient with, again, 1.5 packets of TAKA in 12 ounces of alkaline water and 3 ounces of coconut water, we waited 30 minutes. His cardiac output increased to 4.1 liters. Today, he is no longer on cardiac hospice. He is working part-time. Dr. Wu was able to stent him. Of course, I placed him on 3 other supplements. One was intravenous, weekly for 6 weeks. And this product, he will be on, I told the patient, until you're 99 years old. Never stop TAKA. Globallee family, when you introduce TAKA to people who are 20 to 90, this is a product that you must stay on lifetime for various reasons. So let me take you back to some very important information. The soil in America has been depleted since World War II. You can go to Journal of Nutritional Agriculture Science. We're missing a lot of vitamins and minerals, and I check my patients in the clinic for micronutrients deficiency. It's a lab report, and I'll share that with you all when I'm in Dallas. I'll show you copies of mine. The research, my team and I focused on 4 important things. Does TAKA decrease a patient's endothelial stiffness and endothelial dysfunction, which helps to increase blood flow? The answer is yes. Does TAKA elevate a patient's cardiac output? Because a low cardiac output can cause 6 chronic illnesses, from fatty liver to congestive heart failure to potential for heart attacks and strokes. The answer is yes. Does TAKA alter the functional age of the patient's gut? Cellular age, I can see that on our equipment. Yes, it does, significantly, by 20 to 22 years. And the 4th most important thing, which takes a lot of time to research, does TAKA alter a patient's ejection fraction? Write down the word EF. What is ejection fraction? If a patient has an ejection fraction that is below 30%, they are not a candidate for surgery. A normal ejection fraction is 52 to 65%. That's the amount of blood that all 4 chambers of the heart pump into the aorta. Again, a thoracic surgeon cannot take a patient to surgery if they have a low EF, because it could be a fatality in the operating room. That's phase 2 of my research. What percentage of ejection fraction does TAKA improve when a patient has a low EF? So I'm here looking at one second very impressive report. In October, the CEO of Globallee, our brilliant formulator, had a cardiac non-invasive scan in Dr. Ingram's office in San Antonio, Texas. When I saw the report, I was speechless. Mark McKnight has an endothelial stiffness index of 6.3. The blood flow in his jugular and carotids are so youthful, it's that of a 17-year-old. So I talked to Mark and I said, how long have you been consuming TAKA before we went live? Based on this data, maybe 3 months, 6 months. Rarely do I see anybody with a 6 to a 7. Last week, the average patient who comes into the clinic who is scanned by my cardiac technicians or nurses, they average an 11 to a 22. And I've never seen any number higher than knees. So, all of you, if you choose to have this test done, we're available. My staff of selling will be there. Over the next year, plan it. I only have 20 slots open, or maybe 100 people. Write down endothelial stiffness 6-8. That's where you want to be from now until you're 95. What ingredient in TAKA is causing the result? Ladies and gentlemen, it is L-arginine in grapeseed extract. I don't need to ask the formulator how much L-arginine is in TAKA. I know it's somewhere between 800 and 1200 milligrams in a packet. Having been in cardiology for 37 years, it is truly the amino acid L-arginine, which breaks down to nitric oxide, which is a molecule of life. I love the fact that our brilliant formulator has placed that in Eternal as well. L-arginine is an amino acid that helps vasodilate veins and arteries. So, why do we have 490 milligrams of potassium chloride on that label? Each of you write this down and Google this tonight or tomorrow. Is a low serum potassium level linked to atrial fibrillation, AFib? Yes. Because our soil is so depleted, we are very potassium deficient at the cellular level. And thank you, Mr. Mark, for adding that amount in a product, which is unheard of. You can walk into any vitamin store from GNC, you name it. You will never see more than 100 milligrams of potassium on a label. And that's the amount that Americans need. We need 800 milligrams at 3 meals, minimum 2,100 milligrams from breakfast to bedtime. What changed the gut functional aid? Turmeric and aloe vera in TAKA. It's formulated with 34 unique nutrients and really is lowering inflammation and affecting over 7 organs. I have patients who are off of metformin, are diabetic patients, 13 who are off of beta blockers, blood pressure medication. And I want to caution the group for 2 things. During the final portion of the research, if a patient has a AV sequential pacemaker, they cannot consume TAKA. During the research, I see that 3 of my patients went into a modified SVT, supraventricular tachycardia. And I caution TAKA with patients with pacemakers. If the patient has a blood pressure of 180 over 100, stroke numbers, stabilize the blood pressure first and start them on 1/2 of a packet and 20 ounces of water to be consumed over an hour. Stabilize the blood pressure and then introduce TAKA. Those are the only restrictions other than pregnant women who have a history of preeclampsia. And I will talk about that on a future call in 3 months. I'm working closely with an OB. Thank you so much for your time, ladies and gentlemen. I'm going to give the call back to you, and I'm so excited to meet you all in Dallas. And if there's any questions, I have plenty of time to answer them. I will be there 5 days.
Fantastic, fantastic. Thank you so much, Dr. Ingram.
Thank you.
Thank you for sharing your great, research that you've done here with TAKA. And I know that you're doing the same thing, and you'll come down with that later on with Eternal down the road. But yeah, we're at the right place at the right time, ladies and gentlemen. You heard that from a professional who understands the product and what we have in our hands here. That changes people's lives, ladies and gentlemen.